part of the treatments that you try to help the child or the patient to think positively about the future. But when the child is still feeling unsure about what will happen tomorrow, when this war is going to end, so this is as if we are in this long dark tunnel. There is no care. Everything is destroyed. In these situations, mental health will not be the priority for most of people. They're worried about their own safety, their own survival, their own feed. They are hungry. They are scared. They are frightened. And they need this support from government and non-governmental organizations. But before that, this war needs to stop.
Welcome to the Afikra podcast. My name is Mikey Mhenna. Today on the series, we're talking about healthcare. And with us is Dr. Atif Magbool, who is part of Sidra Medicine. And we're talking about something that I think we should be talking about more on this series, but it's just in society more generally, which is healthcare for women and children in crisis-affected areas. So, Atif, welcome to the series. Thanks so much for being with us.
Thank you very much, Mike.
Maybe let's talk a little bit about psychiatry for a second. How did you get into psychiatry and focusing on children to begin with, pediatric psychiatry?
So you are taking me to my early days when I was a little child. I was born in a small town surrounded by a number of villages in Sudan. It's called Tabat. And in this small town, we have sheikh and traditional healers. And I used to see children and adults who are mentally unwell to come seeking treatment from the sheikh. And I involved a lot of ways to help them. And surprisingly, a lot of them, they get better. So I was curious to see how this spiritual healing works. But I was shocked when I was very young, maybe 10 or 9 year old, when I saw one of the very young man was beaten and whipped because it was believed that he was possessed by jinn, and it was believed that this will drive the shaitan out of his body. And that touched me a lot, deeply. And I was thinking there must be different and more compassionate, more scientific ways to deliver care for this kind of disorders. This experience also coincided with me when I was in the primary school, watching my classmates, who I believe now they had ADHD, learning difficulties, or other developmental disorders. But at that time, nobody knew about it, and it was felt that they are just naughty boys, or stupid, or they are not listening. So this experience made me pursue psychiatry as a career. And first I studied medicine in Sudan, and then I did my training in adult psychiatry. But I was always thinking about the young man and the classmate that I saw. So it made me even more thinking about pursuing child psychiatry. And I did the training in Ireland and the UK before coming to Qatar 8 years ago.
What is different about child psychiatry versus psychiatry more broadly? Like, somebody hears, oh, Atif is a psychiatrist. That means, it's similar to the therapist I go see, or somebody has mental problems, they go see Atif. What is different about the field of study for psychiatry for children specifically versus for adults?
So psychiatry for children is a little bit complicated and complex Because for adults, they can express their emotions, their feelings, they can talk, and they can you can assess them easily. While with children, you need to have more skills to be able to understand their sufferings, their feelings, even without talking or without telling you everything. So a lot of the times you work as detectives and you use your instinct to understand deeply what's wrong with this child. And also, it's not just taking the child as just one person. No, you take the whole family. So it's to help the child and their family during difficult times, because if the child does not get the right help since he was young, and that means it will affect his schooling, his education, and his base will not be solid. So if they don't start strong, they will not do well in their life. So it is important to tackle any difficulties that the child is having since the beginning. And going back to your question about therapists and psychiatrists, the therapist usually is about assessing and providing talking therapy, giving advice, helping people to cope with difficulties, and giving them some positive strategies to stop their sufferings. While in the psychiatrist, in addition to that, we prescribe medication. When we feel that the child or the patient cannot cope only with just advice on their psychotherapy, we add medication to help regulate their mood or anxiety, or if there is a psychotic illness, we prescribe medication to help them to regulate their emotions and their well-being.
So tell us a little bit about the Gaza Patient Program. What is this? What has been your role? I mean, both in places like Sudan and places like Palestine, we see the conflicts and the genocide play out on social media. Like somebody like me, I see it and I see just photo and video after video after video of children who are being completely I have a hard time seeing the videos. I can't imagine what it must be for them to like live the moments.
I can tell you, Mick, it's totally different seeing it on the TV or hearing about it, while compared to living with it, living with the people who suffer through it and have been through those difficulties. So Sidra established this program in 2014 to help children who suffered this genocide war, and it was life-saving for injured children and their families who were brought to Qatar at that time, and it was offering for them comprehensive medical, surgical, and psychological services. So once they arrive, they come in a group. They will sit together as a team to decide what's the priority. Is it the medical or surgical or psychological? And based on that, the team will work. So we'll make a plan for the child and the family. Of course, medical and surgical emergencies comes first, but our role as psychiatrist and with my team, we have a psychiatrist, psychologist, social worker, child life, and occupational therapist, art therapist. So we all work together as one team, and we try to support the child and their carers during this difficult time from day one. First priority is to make them feel that they are in supportive environment. They are safe because they came from an area where they were feeling unsafe, and there is no security, there is no any way of feeling safe. So making them feel safe, this will help reduce their anxiety, their depression, and then working with them to manage their emotions, staying positive, build resilience, and support them during their medical or surgical procedures in and out, because a lot of them, they had to go through a number of operations and a number of treatments and spend a long time in the hospital and sometimes in and out from the hospital. So our team, our psychiatric team, we have been heavily involved with all children, providing this support, for just this emotional support. And when we identify that there is some of them, they need heavy input, then we focus on them in the deeper kind of psychotherapy. Some of the children may need just space to ventilate, to play. So we use play therapy, art therapy, psychological support, supportive listening, all this to help children or younger just to cope with the difficulty and to build resilience. For other children that we feel they need more than that, we start therapy. Well, we call it cognitive behavior therapy. For short, it's called CBT. And also there is a specific type for trauma called trauma-focused CBT. It focuses on the trauma, the child, and how to help him to process it and to cope with it. And if this also was not enough, we consider medication to help with anxiety or depression or others. So it's a comprehensive package. This could be just simple initial psychological intervention, supportive, or psychological therapy, just sessions, regular sessions, including this cognitive behavior therapy, or sometimes we use pharmacology, which is medication.
You know, and I'm from Beirut, right? And one of the terms that you hear about people from Lebanon, from Sudan, from Palestine, from Iraq, you hear this idea of these are resilient, right? People are resilient. There's a sense of resilience. And lately there's been a pushback against that term, saying, I don't want to be resilient anymore. And no, I just want to live. As a scientist and as a doctor, how do you feel when people say this about, you know, in this case, kids from Palestine, that they must be so resilient?
It's a very interesting question, and based on my experience, I would agree with that because I had seen children before while I was working in Ireland and in the UK, and other patients coming from conflict and war zones who suffer from post-traumatic stress disorder or other mental health disorders. But when I started to work with the patients and Palestinian people, I have noticed that their coping skills are much better than other people that I saw. And you are right, the people from Sudan, people from Lebanon, and indecent people from Palestine, because they had been through this generation-wise. So even the child, since he was a baby, he had seen or heard from his parents about this. So it was not a shock or surprise to them to live through this. They kind of prepared or aware of it. So this remarkable resilience, I have seen it. And although I cannot generalize it, not everybody is having this resilience or having this strong personality, but a lot of them, they showed huge improvement. And even you can use them sometimes as role model for other patients who could not cope, to just show them that it's a process, you will get better. And look at your peer or friend, he was suffering more, now he's better, he's back to school, he's having normal life, he's enjoying life, he's playing, he's having fun in his life. So this will happen to you. So it is. I know it is. Should not be generalized resilience, no, but it is a reality with children of Gaza. I have seen it.
In the case of the term like post-traumatic stress disorder, in the case of Palestine, there is no post right now. It's continuous. The trauma is continuous. The stress is continuous. The conflict, unfortunately, is continuous. How does the treatment change for those types of patients and those types of kids, where it's not a single event that happened and then, khalas, we need to just process and deal with it? How do you deal with the treatment?
That's a big challenge, and that's exactly what we are struggling with now, because part of the treatments that you try to help the child or the patient to think positively about the future, to be able to plan for the future and to think about, but when the child is still feeling unsafe and is unsure about what will happen tomorrow, when this war is going to end, when he can go back to his home, or is he ever going to meet again with his family members or peers or other people he lived with. So this, as if we are in this long dark tunnel, and it makes the work very hard, but we are trying our best to support and to try to help the children to cope with the difficulty to live with, I agree with you, with this post-traumatic stress disorder is ongoing for them, because we divide the stress disorder to two types: acute stress disorder and post-traumatic stress disorder. Usually the acute stress disorder, that will happen within 1 week of the trauma, and the post-traumatic usually beyond 1 month and can last for 6 months or even more than that. And this is what's happening now. It's ongoing. They're still suffering from the trauma. They're still having stressors, but a lot of them improved with the support, the psychological support, the other logistic support that they have received here in Qatar and in Sidra.
Yeah. Can I ask about the healthcare sector in Palestine? That your colleagues who are based in Palestine right now, there's been a lot of information on the news over the last 18 months about how much the healthcare system was targeted. Are you still working with scientists and doctors and psychiatrists on the ground in Gaza or in the rest of Palestine?
Yeah, when we communicate and when we get feedback, it's big challenges, because there is no care. Everything is destroyed. There is no hospitals. Even before the war, they didn't have that big structural mental health services. They had, but it's not that well established, covering the whole need. And then when the war came, even this disappeared. So they are really struggling, and there is no places. They use just shelters, mobile clinics to help. So there is no access to the care, and there is no continuity of care. And there is this resource constraint. So there is no enough trained professionals to help. And the other challenge, in these situations, mental health will not be the priority for most of people. They are worried about their own safety, their own survival, their own feed. They are hungry. They are scared. They are frightened. So the last thing they will look for it is mental health, as if it is privilege or this is something that it's not the time for it. Now we need to survive. We need to eat. We need to be in a safe place. So the feedback from there, everything is just went downhill, and they need this support from government and non-governmental organizations. But before that, this war need to stop. This genocide need to stop. Before that, nothing can be done. A lot of things that can be done cannot be done during war.
It's awful. It's how do you? I mean, personally, Atif, how do you maintain your own sense of purpose and sense of stability to be able to do this type of work?
At the beginning, it was very hard when you come and you speak to children who were the only survivor from their family. They were pulled out from the wreckers, and the child will tell you that my parents died, my siblings died, my aunt, my aunties, the entire family. He's the only survivor, and you don't know what to say to them. What kind of hope you can give them? How can you support them? And it's a lot of stories. Some children, they lost part of their body, their legs amputated or eyes. They are having burns, and they needed to go through a lot of surgical operations. And they have witnessed a lot of traumatic events. Their family members died, their neighbors, their homes demolished, destroyed. So all their memories from their childhood. So it was really heartbreaking. And I used to feel very, very emotional about it. And even it affected me at the beginning. But I had to stand, because I'm professional and I need to be strong to be able to support my clients and my patients and their families. So I tended to hear and to listen and to try to support them, but tend to forget about it. When I leave the hospital, when I go home, I didn't want this to affect my social life, my family, my children, my neighbors. So I don't talk about it. I kept it to myself. And even watching the news, I can see as the difference while I was watching the news before, starting to see patients from Gaza, and when I saw them in reality, and when I saw the suffering that they had been through. And you will ask yourself, will they ever recover? Will their wound heal? Sometimes you feel it is very hard, but as I said earlier, with the support, with the psychological help and other logistic support, a lot of them, they were able to survive and to cope and to maintain their well-being mentally and physically.
It's even just hearing you speak about it now, I don't really know how I would deal with that situation. Anjad, like
I wouldn't hide from you, Mikey. A lot of times I was tearful. I tried to hide myself from others and go to a quiet place and just ventilate my emotions, because I cannot do that in front of a child who's telling me all these sad stories about himself, and I'm supposed to support him. So I just go away, take some time out, ventilate my emotions. I cry, but I want to come back with a brave face, show them that they need to be positive, they need to be resilient, everything will be better, this and that. And it has really affected me badly, and even it changed my way of helping others, because when I came at the beginning, because I felt that they are really need a lot of help, but some of them, even when I saw their patients, the way they spoke about it and how they are strong and how they are brave, despite going through a lot of these difficulties, I felt that even they have given me strength. They are making me even feel stronger, that I should not be weak in front of them. And it has changed the way that I view psychiatry and view children coming from these war zones or conflict areas.
Do you think that there is this idea of discussing sadness and discussing trauma and feeling those feelings, instead of, as they say, have a stiff upper lip and just say, "Khalas, everything's fine, everything's fine, everything's fine." Do you think there is a healthy approach to this type of trauma? I guess that's the right question. I mean, as a society, are we talking about it enough? Are we allowing people to express their sadness? Do you think we have a healthy relationship with this type of set of emotions?
If we're talking in general, I cannot say a lot, but I think we don't have in. But if we're talking about experience here in Sidra and in Qatar, I think we have done a lot. Those families and children, they were very welcomed. They were very well received. All their needs have been met, whether it was medical, surgical, psychological, or even educational. The children were allowed to go to schools, and they were provided with very good facilities, accommodations, support from the society, from professionals, and all kinds of support. So I think here in Qatar, the country has provided a lot of support, and it was really something to be proud of, because every child or their carer who came to Qatar, they receive the best support that can be provided. I don't know about other countries what they have done, but the support that when it's being provided here in Qatar, I can say it was amazing and still ongoing. There is still support going on place, and I think it will continue until this genocide finishes.
What happens after? Let's, inshallah, the genocide finishes as soon as possible. What happens afterwards for these families and for these parents and children? What happens afterwards?
So you are talking about the one who are currently in Qatar?
In general.
Or in general?
In general.
Yeah, in general, I believe that knowing the Palestinian people, they want to go back to their country. They want to live there. They will not easily give up and try to live somewhere else. But it's a question about when they go there, how they will cope, and if this is going to affect their emotional well-being or their restoration of mental health. I can not say for guarantee that this will happen in the current circumstances, because mental health cannot exist in isolation of the context. I mean, if the people are away from home and away from their loved ones, and they don't have the feeling of security, and they are having these issues about anger, feeling deprived. It's not easy to talk about this. And one thing to say about this, most children, if not all of them, who are from Gaza and who present with this emotional sufferings, it's not arising from interpersonal pressure. It's not from it's not internal from their children themselves. It was imposed on them by external reality, including the oppression, the genocide, the displacement, all the violence they have been through. So if this continues to be straight for them, whether they go back or be unsure if this war is, even if it stopped, is going to happen again or not, this is not going to make mental health restoration. It will be ongoing, and I have to be clear about this. And I know the collective trauma is even if it happened in the past, but the memory of it and seeing going back, so is still going to be a big challenge for the mental health professionals in Gaza after the war, so that a lot of efforts should be done from other organizations to support people even after the war. So it's not just supporting them now through this difficult time, even after the war. They need a lot of support. They need this access to care, and they need trained professionals and all the facilities that they have been receiving, for example, in Qatar or in other countries, must be available to them in their own country when they go back, to be able to maintain their mental well-being.
Yeah. Before we go, I want to ask you about mothers. Sidra, is for women and children. As an institution, it's focused on women and children. I'd love to know about the psychiatric help for women, for mothers specifically with acute stress disorder. Is the approach different at all? Is there anything meaningfully different?
We have to say that for women who had been through similar traumatic event, they face the same challenges and the same mental difficulties as anybody else. But in addition to that, they have other things that they add to them. Being a female, this gender, social stigma and expectation from a female. Also, not having basic needs during this difficult time, like their own sanitary health and those all issues. And even if they are married or they got pregnant, how to care for themselves, for their children, and also even wanting to have a baby, wanting to go to the hospital to deliver as a child, caring after the child after being born. All of these difficulties that are unique to women and females compared to men. So they suffer a lot, even compared to, and they need additional support from mental health professionals and other professionals. And this is what we have identified, and this is what we have worked on. They needed this support, they needed sometimes I hear from stories that even the social pressure and even for some children they were forced to get married early or sooner because of the responsibility and because of this instability. So there's additional stressor to women compared to men or children. And it has been highlighted and it has been addressed. the losing of close family members, especially for children, losing their families, even losing part of their bodies, and finding themselves without doing anything wrong in a different country, away from everybody, not knowing what's going to happen to them tomorrow or after tomorrow. Are they going to survive? And this reminds me of a 5-year-old girl that I was seeing in the world, and who lost her siblings and her father, and she was very attached to her mother in her room in the hospital. She was screaming and crying because she was scared that an airstrike may come, or a bomb will be, or any attack will happen to the hospital. Despite reassuring her, we are far away from that area, you are safe here. But it was very difficult to make her get this feeling of safety or feeling secure. It is really unfair. This war is devastating. It is causing a lot of distress to everybody. I wish that it will stop as soon as possible. We should all advocate for ceasefire, for those people who are suffering, to end their suffering and to go back to their home and to enjoy their life that they deserve. It's unfair of the children and their families to do this while there is silence. Most of the countries are not doing enough in the war. There's no enough support. There is nobody is heavily involved of making this genocide stop. It's ongoing and we don't know for how long. And there is no mental health without can be achieved without the end of this war. We cannot do that. There is no physical health without mental health, and there is no mental health without physical health. And physical health and mental health does not mean anything if you are still suffering, if you are still away from your home. If you cannot communicate with your own people you love and you are worried about them. Even if you went out, you feel safe physically, but you are worried about your other family members, neighbors, friends. You don't know, are they still alive? And there's no communication, you cannot know. This suffering should end as soon as possible.
Inshallah. Thank you, Dr. Atif. Thanks so much.
You're very welcome. Thank you. Assalamu alaikum.